Today we're going to come in and do trach care on our patient. He is currently going to be on some humidified air. Also, our pressure for our suction is going to go ahead and be on. I'm going to go ahead and start out by putting this behind his neck so I have it ready for when we're ready to change it. Leave it right there. I'm going to go ahead and listen to his breath sounds to make sure that tube placement and everything is good. Alright, perfect. Next up, I'm going to go ahead and get all my supplies ready. I'm going to go ahead and make sure that we go ahead and suction, inline suction or open line, depending if there is an inline, and that we also go ahead and use our yonker, get their mouth, and remove anything that they might cough up. So next up, I'm going to go ahead and loosen his trach collar. We're going to leave it right here so they're still receiving at least some kind of air. We'll go ahead and do all of our process. Go ahead and put this over here. Go ahead and stuff. Alright, so in our big one, we're going to go ahead and put a ratio 1:1 of hydrogen peroxide and sterile water. And then sterile water over here. So we're going to go ahead and start out by loosening this right here. Go ahead and check the side of the stoma, make sure that it's nice and pretty. And hold the phalange. Grab this, swipe out and away, and then swipe out and away. Alright, so while I'm already here, I'm going to go ahead and put the new collar on to hold it stable. I'm going to go ahead and take this side out. Take out the rest of this. Grab a new one. Out. New one. And out. While I'm still sitting here holding all this, I'm going to go ahead and grab a gauze. I'm going to saturate it in hydrogen peroxide. And go ahead and just kind of clean over, clean under, and make sure that it's nice and pretty and not getting gross. Now we're going to go ahead and put in our new gauze. And while I'm doing this, I'm going to go ahead and take the cannula out and let it soak in there. Tighten this here a little bit more. Still a little loose. Tighten it a little bit more on this side. Alright, there's about 2 fingers in there. Good. Now we're going to go ahead, clean our inner cannula. Make sure that it's nice and clean. All that gross stuff is out. I like to do it on both ends to make sure that we get it. And with these right here, just make sure that we get anything out. Obviously right now, this would be if it is one that we have to clean out and whatnot. You know, put it at 90 degrees. But if we have a disposable one, you would literally just go ahead and get a new one in and out. Alright, so I'm going to go ahead and put this back on him. Go ahead, listen chest sounds again, make sure that everything is still in place. Great. Just make sure he's nice and set up. Grab all my equipment and throw it out. And we'll be back to check on him and give him another care in a few hours.